been talking about type 2 diabetes and a lot of the problems that result from it. I guess if there's good news, it is treatable, is it not? I mean, what sort of things can you do if someone is already down that road?
Yeah, that's an excellent question, and I guess I would back that up a bit and say the better news is that it's preventable.
Sure.
And that we know through very well-designed clinical trials that lifestyle modification prevents type 2 diabetes and prevents it actually better than early drug therapy for type 2 diabetes. So I think that's the best news, is as we increase awareness about type 2 diabetes and we talk about the importance of being screened and just having that as a, we're all at risk for developing type 2 diabetes. So I think being aware of that can help with some of our prevention efforts as well. Mm-hmm. In terms of treatment, though, once the diagnosis has been established, we have lots of different treatments. Of course, we have drug therapies. As a naturopathic doctor, I tend to still emphasize the lifestyle change because we see that as very, very, very important and just fundamental, not only to slowing the progression, but even, in some cases, even reversing or sort of turning type 2 diabetes back either into prediabetes or into normal glucose tolerance. And without the lifestyle changes, I would say it's nearly impossible to really slow the progression and stop the condition. Once the lifestyle pieces are in place, sometimes for various reasons, either people can only make so many changes or the lifestyle changes sort of reach a certain threshold, and if the disease is severe enough, despite lifestyle changes, the blood sugar still may be high and drug therapy may be required. So there are oral medications, tablets and things that are FDA approved for treating diabetes. And then ultimately, most people with diabetes do require some extra insulin to treat their diabetes. And again, as we talked about at the very beginning, type 2 diabetes is also associated with this deficiency of insulin. And the statistic is that at the time of diagnosis, insulin production is about 35% of normal. So if you think about that in terms of the lifestyle, our carbohydrate intake in our diet requires insulin to process and for us to use that energy. So at 35% of normal insulin secretion, you can already sort of guess that reducing dietary carbohydrates is a very important part of managing it, as well as getting by with as little extra insulin as possible. And getting by with as little extra insulin as possible is important because insulin is known to cause weight gain. And if all that glucose in the bloodstream, which I consider sort of stored energy, right? It's energy that isn't being used by our tissues, so it stays in our bloodstream. And if we use insulin to pull that energy out of our bloodstream, we're going to store that as fat, and so people gain weight.